Good evening, everyone, and welcome to the African Region webinar titled Mental Health in Africa and Why Many Suffer in Silence, Part 1. My name is Philani Kinyabo, and I'm so proud to be sharing the platform with amazing guest speakers who have deep stories and revelations to share as far as mental health is concerned. Stories have the tendency to break stigma, discrimination, as well as enlighten people about misconceptions of mental health. We will hear from Blessing, Refilwe, Obinna, and Lucy. This is all possible because of Avis Mental Health, and I'd like to thank them for giving us this opportunity to not only share stories, experiences, but also impact lives. So please sit back, relax, and get ready for an awesome webinar. And please remember that there's a Q&A, a question and answer section for questions. If you have any questions, please put them in the question and answer section. And then at the end of the webinar, we'll be able to answer your questions. So you can give the questions to any one of the presenters today. So welcome everyone. So I will start with Blessing. Blessing, please tell us the country you come from and tell us about your work.
Hi, everybody. So, my name is Blessing Adams. I live in Accra, Ghana. My work is very much people centered. So, I am a lived experience expert with Avis Mental Health, and I'm also building the Revel project, which creates well being ecosystems for young people here in Ghana. So, it's exciting to be here and see all these awesome faces. Thank you very much.
Oh, great. Amazing work, I see. Thank you so much, Blessing. And Obinna Peter Ekeleme, can you please tell us a bit about you, your work, and what you do, and which country you come from?
Okay, hello everyone. My name is Obinna Peter Ekeleme from Nigeria. I'm an expert advocate for global lived experience at Harvest Mental Health. What I do is I help amplify the voices of those who live experience and also help to create a resilience community. Yeah, thank you very much.
Okay, thank you so much. A resilient community. Interesting. And then we have Refilwe Nkwe. Please just tell us where you come from and a bit about your work.
Hi, everybody. My name is Refilwe Nkwe. I'm from Botswana, beautiful country, small country. I work in mental health. I did study psychology, but my work is mostly I do my work mostly because of my lived experience in mental health. I work with communities and young people, and we build spaces where uncomfortable conversations about mental health can be had. I love um, using my creativity in so many ways, and I enjoy working in the advocacy space.
Oh, nice. Enjoy working in the advocacy space. So that is interesting and very, I would say, is it a calling for you?
Interesting you say that. Actually, I don't know. Probably is because I'd say I've always run towards, let's say, creativity, for example. And then when it comes to the mental health space, even just studying psychology, I don't know how I ended up studying it, but I always felt drawn to it. So in a way, if I can't really fully explain why I was drawn to psychology, so I'll assume it being a calling because I can't fully explain why.
Okay,
But yeah.
very interesting. So today we will start with Blessing. Hi, Blessing. So I want to know, your work emphasizes on inner development for outer change. How can young people in Ghana cultivate their inner strength whilst facing external pressures like stigma and limited access to care? And just another note to the attendees, please, if you have any questions or anything you'd like to ask the presenters, please put it in the Q&A and then we will address those towards the end of the webinar. Okay, Blessing, you go ahead.
Okay, thank you so much for that question. So when I started out into this like field of inner development, I had a lot of concerns because first it was too westernized, and two I felt like it was putting too much emphasis on like the individual. So I want to preface this by saying that the fact that there's inner development for outer change and all of that doesn't take away from the systems that are not working. If you're somebody that's disabled, if you're somebody that's queer, if you're somebody that's mad, if you're somebody on the spectrum, there are systems that are real that are made to exclude you. So I want us to really understand that it doesn't take away from the fact that these systems exist and they are failing us. But then you have two options. You can stick with the despair, or you can move to like an approach that is more of constructive hope. So this is hope that's not like mere optimism, but it's taking little steps day by day, even in the uncertainty, to do things that make you feel better. So inner development is made up of 5 dimensions. That's being, thinking, relating, acting, and collaborating. So we are speaking about being because that's more of the internal work. So the importance is that when you do this work of inner work, you're able to have more self-knowledge, more self-awareness. And it's also very important because with stigma, you have people telling you a story about yourself. You have people trying to reduce you to a diagnosis, but you're more than that. Your personhood is like very holistic. It's made up of so many beautiful things. And so when you're able to have that self-knowledge and that self-awareness, you're able to ignore the words of people outside whatever they have to say. And also when it comes to strength, I think we have a wrong impression. A lot of Africans, we are used to saying, I'm okay, oh, I'm fine, I'll firm it. But I think that's very, very problematic because strength is also about knowing your limits and your boundaries and being able to state that clearly. A lot of us say, I am a people pleaser, but you're a person. Are you pleased? Like, these are questions I think we need to ask ourselves and really think about a lot. And so, when we are able to redefine that and have that self awareness, you also have self compassion because it helps you to now love yourself. Like, the systems are already against you, the world is hard. Are you going to be harder on yourself? And I like this because it's very low barrier. Things like journaling, meditation, contemplation, these are things that you can easily do from the comfort of your house just to feel better and have that inner strength and inner resilience. And we are human beings. We don't exist in a vacuum. So it's definitely relational. You see that the more you do that inner work and you also relate to other people in the community, it extends outward. It's like a mycelium of care. And now we're able to build more compassionate systems. We're able to reimagine new ways of being, and then we're able to create like better healthcare systems, better mental health interventions. And yeah, I think I'll end it here for now. Thank you.
Okay, but you talked about, like we have this culture. I would ask someone, "How are you?" And everyone is just like, "Ah, no, I'm okay. I'm great. I'm amazing." Where does that come from, though? I mean, what makes people want to say that when they're actually not okay? Because we've heard that expression that it's okay to not be okay. So why do people feel that they need to always come or always look like they are okay when they're actually not?
Okay, so I will speak from my personal lived experience. There are a lot of reasons why. First of all, stigma. Stigma is a big thing because right now, even the fact that people say you can talk about it, if you hear people on the African continent, it's now that we have lived experience experts who can speak openly. But back then, if you say something like, I have schizophrenia, or I have bipolar disorder, or I have anxiety, I have depression, people already have an impression of you which doesn't equate to who you truly are, who you are as a total person. Another thing is the thing of religion and spirituality. People think that you are being haunted by evil spirits. People think that you have a curse like in your bloodline. It's like a lot of things. And I think people are also used to reaching out and asking for help and not getting it. So they feel like at this point I should just swallow it down and just keep it in. But it's very, very harmful, especially for men, because of that stigma around you're a man, be strong, don't cry. I think it really contributes to that like culture of toxic masculinity. And I think it's something that needs to change and needs to stop because it affects every single one of us. So yeah, I'll end there.
Okay, okay. And I guess another question is, you talk about healing, well-being ecosystems are central to your work. The Revel project? Yes. Please share a bit about your work and what unique advantages peer-driven models have over traditional clinical approaches, especially in African contexts.
Okay, so I remember the first time that I really saw that there was a crack in the system was when I was in university. One of my friends had a breakdown that was very, very serious, and we're trying to get help. we went to the university hospital and we're told that there was only one psychiatrist and we needed to come back on Wednesday. And that was on Monday. So I needed to stay with her for 2 whole nights, keeping her safe. Meanwhile, she wasn't okay. These are the kind of challenges and things that we have where mental health care is very inaccessible, or it's expensive, or it's not tailored to our lived experiences. And it just seems like a Western import. So with these kind of things, like peer support fills a gap that does exist. And I really like peer support because I feel like it's like a beautiful thing of somebody you coming into a space with your full self and understanding that the people there see you for who you are. Some of them have been through the same experiences. They hold no judgment for you. And also you know that in that kind of space, the people there, the advice they're giving you is not theoretical. It's hard won, it's battle tested. These are things that they have been through and things that help them, and they're also like sharing it with you to also like help you feel better. So I want to say that there's a place for medicine, there's a place for therapy, there's a place for policy. I'm not disputing that fact, but that gap does exist in Africa here. And it's something that until we're able to like properly like integrate like mental health care into primary health care and all of that, that gap will always exist. See like the beautiful work that organizations like the Friendship Bench are doing. These are low cost like alternatives that you have where you're using the actual people in the community. And it's really nice because now belonging is not just an add-on. Belonging is like the framework that everything is built on. Understanding that we are human beings, we are relational, we have needs to connect with other people. And so we come together and then we're able to build this like shared support network. And I just find it really beautiful. For example, at the Revel Project, one of the things we started is Hear Us Out, is a storytelling like platform where people are able to share their like lived experiences and their stories. And you see that it started out with one person. I was the first person who submitted my story. And after that, I saw that other people saw it and started submitting. So far, we've had about 9 submissions and more are coming in. And it's really nice to see that just one little step I took allowed
Mm.
it to grow into some of like somewhat of a system, like a circle, like a cycle. So these are the kind of things that I want to see. So like I said, I think that this is a gap that does exist. So it needs more funding, it needs more support, it needs more research because we can't
Mm.
just go off of vibes. We actually need like research to back everything that we are doing. And we also need training because not everybody can be a peer supporter. I mean, you can support people, but to actually be a peer supporter, you do need some training. Make sure you understand like boundaries and ethics and all of that, just to make sure that you are keeping a safe space and trauma informed. So yeah, I think I'll end here too.
No problem. Thank you so much for that information. I just have this question that have you actually seen lives change through the work that you do? And how does it make you feel when you actually see that, you know, my work is actually helping someone? If you can tell us even a story that you can remember that you think you'd like to just tell us about how the work you are doing has impacted and changed people's lives.
So I'll preface this to say that the work is pretty early, but one thing that really struck my heart was when someone reached out to me because my friend referred her to me, and she was explaining to me that she had tried to get therapy, and they were telling her that a 45-minute session was going to be 900 CDs. So to give context, that's about $90. She's like 22 years old. We are young people. How many of us earn that much to be able to afford therapy? And she does need it. But at that point in time, it was something that was not accessible to her. So my friend mentioned my name to her. She reached out to me. We were able to have a session online. And just through sharing my lived experiences and connecting with her, she was able to feel better. Like the fact that she could tell me that I helped her at a point that she needed it is the kind of motivation that this is work I need to continue. It's very early, but I'm not going to give up and I'm going to keep pushing till I'm making the kind of impact that I want to make. Thank you.
Great. Thank you so much, Blessing. Thank you so much for that information. And thank you so much for the work that you do that is impacting people, especially people who cannot afford the services that they need. At least you're there. And I hope you get even more funding, even more research opportunities, even more distinctions. So thank you so much for that. So now we will go to Mr. Obinna Peter Ekeleme from Nigeria. How are you doing today?
Yeah, I'm doing great. Thank you, Fina. I'm doing great.
You're doing great. Okay, so please just tell me a bit about your story and a bit about yourself.
Okay, as I earlier introduced, my name is Obinna Ekeleme Peter. I'm a survivor of a domestic gas explosion. Yes, and of course, uh, initially at the earlier point, after doing the incident, I thought I thought that the greatest challenge I might have to encounter was just the healing, the physical healing, the pain, doing surgery, and all that. So, but later discovered that one of the greatest challenge I had to encounter was the emotional wounds that came after the incident, and that was what navigate my life pattern and change my orientation, my thought, and even inform what I do and what I love doing presently.
Okay, interesting. So, having survived severe trauma, how has your experience, your personal recovery shaped the way you design trauma healing initiatives for communities in Nigeria?
Thank you, Fina. That was a very good question. Having survived trauma personally, going through the journey of recovery, I come to understand that healing is not just physical. Healing is also more as much emotional, and it's something that requires not just an individual something and someone can do alone. It requires support, both professional, both families, those around. But there's something I discovered is people often overlook the emotional wound that we have. They often focus on the physical wounds, whereby they try to encourage you, to, it's well with you. They use all those phrases, it's well with you, you are strong, you can do this, and just thank God that you're alive. But in as much as those things are good, but that alone didn't just, it's not just enough. It doesn't heal the wound, and it doesn't take away the pain that we feel within us. So this has informed my initiative and towards trauma healing, and also the designing trauma initiative that I do in Nigeria, because it helps me to understand that creating a safe space for survival is very important. So what we do, or what I do also, is we create safe space for survivors to be able to express themselves without feeling judgmental. Because when people are able to express themselves, that's when also healing begins to happen in that process. When people begin to express themselves, their voices are being heard, they believe they are being seen, and of course, that barrier, that stigma, that shame is being broken. And also, one thing I also encourage is storytelling. It in part of my work, I tell a lot of stories. I tell stories. I tell my stories to people. So I encourage them to also tell their stories, because when they begin to tell their stories, they feel heard, and you also help them to feel safe within the community, or within at the cost of uh you know sharing within the community in which they are. Telling their story help them to feel safe. Okay. And also, one thing I also encourage is peer support. Peer support, whereby there's something different between someone giving you a clinical help, using clinical knowledge to offer you a help, and there's something different with someone also telling you that I have been here. I understand what you're going through. So peer support is something we initiate in our design, whereby having people who walk along people who are suffering, not just from a clinical perspective, but a perspective of, I have experienced this thing you have experienced, and I'm willing to work with you towards recovery. And again, one thing we do, where I am in Nigeria, Plateau State, we have often experienced violence, displacement, and all those. So we don't base healing only on individual. We also base healing on community. So we ensure the community are also carried along in healing, because when the community are healed, you find out that the community builds resilience, and the healing is not just it's now, they are now informed on also how to help one another in the process of recovery. Yeah, so
But
these are part of the initiative. Yes.
thank you so much. Thank you so much, Obinna. But I have a question is, can a person be completely healed? Is that possible? Where you can say, you know what, I am completely healed from this situation or from the trauma that they have gone through? And what does that look like?
Thank you, Fina. For me, I would say healing is a journey. Healing is a journey, and there's no quick fix to healing. It's a journey, and it's not something that happens in one event. In as much as we go through that process, sometimes we see ourselves coming back to the initial point of that pain we had when we experienced that. But as we keep moving on, we find out that we don't know, it's possibly we don't know that feel that pain the way we felt it before. So it's a journey. I won't really say someone can be completely healed, but I can say someone can build resilience in order to cope either with the trauma or the mental illnesses and and move on, but not completely healed. I won't really say someone can be completely healed, but of course we differ. Individuals differ, but it depends. There are factors. Community factors have a part to play. Your surrounding, your environment, and the kind of support you receive, your family support. These are some factors that make that possible also. Yes.
So I guess maybe there are people who can be completely healed, and there's some people who learn, as you said, to be resilient and learn to like having coping mechanisms. And another question is, you advocate for integrating lived experience into policy and practice. What risks do mental health systems face if they fail to meaningfully include voices like yours?
Thank you. If mental health professionals or mental health system overlook voices like us, people with lived experience, they tend to design a service that looks good on paper. It may look good on paper, but might not actually serve the purpose or serve the aim or serve the people in which they're actually meant for. So bringing in people with lived experience, people who have actually gone through that situation themselves, it helps the system. It helps the system to be informed of some of those recovery barriers that might be overlooked or might be overlooked by the system. But involving people with lived experience, we keep them informed on how best to design these services to actually meet the needs of those in which it is meant for. So it's more like involving planning with people, planning the design with the people in which you intend to serve, and that makes it more effective. So another thing also is you lose the if if they look if they seem to ignore those with lived experience, then it's more like the barriers, the stigma and the cultural barriers that have been one challenge in which mental health faced in Africa will remain and might not actually get a very good solution. Because people who have lived experience have actually navigated this process. They have actually seen these barriers, these cultural barriers, this stigma. They have experienced it firsthand. So they have felt it and they have come out of it. So they know the best way in which others also can come out of it. So it's more like, see it in this way. Mental health professionals offer clinical support, while or clinical expertise, while people live experience offer practical expertise. So it's not like they are competing with one another, they are complementing each other. But if one part is being overlooked, there will be a gap that might not be actually covered.
Oh, thank you. Thank you. I like what you said that they complement each other because sometimes we feel like the clinical is more important or the lived experience is more important, but it's like working together in synergies. And just the last question is, have you worked with people like in the expert? I'm sure you have worked with people who are experts or clinical experts. And do you think they're really open to working with people with lived experience, or they just do it because they have to? But are they open to working with people with lived experience?
Yes. Yes, I would say yes with my whole heart. I would say yes because there's something like, just for example now, if you are sick, let's say for example, you are sick, you have an injured leg, and you walk into a hospital and all you can see is pregnant women, of course, you will feel, you ask yourself, am I in the right place? Is it the best place to be? But having come in contact with someone who have similar experiences like yours, that's not just support, that is hope. So of course, you are not just working, it's like hope. You have seen someone who have gone through your difficult fear and come out of it. So it's hope. I would I have had that experience. I have had someone who walked me through that journey. So, and in fact, that was a defining moment for me that changed everything for me. So I believe people are willing to work with lived experience. I won't say more than the clinical, but I would say they are willing to work with people with lived experience because this offer reality, life,
Mm.
real life for them, not just theory and paper. I'm just saying. Yes. Thank
Okay,
you.
thank you. And Blessing mentioned something about training. Is there training for people with lived experience, or you just offer your lived experience?
No, they are training for people with live experience. Because one
Mm.
thing is to have the knowledge, another thing is how do you apply the knowledge in which you have. So you need someone to guide you on the best way to apply your knowledge in order to also help those. Because there are technical approaches to this. So you don't cause more harm than good than you intend to do. Yes.
Ah,
So there are series of training one have to go through in order to come to that point whereby you're able to help someone with your lived experience.
oh, thank you so much, Obinna. Thank you so much for that input. It's really exciting to hear the work that is happening when it comes to people with lived experience, because I think, as I say, nothing for us without us. So, as people with lived experience, it's good to have systems, to have things that are going on that we can be involved in and also have a voice as well. So, thank you so much for your input. Next, we have Refilwe. How are you doing?
Hi everyone. I'm doing great. I'm excited. It's been an
No.
insightful session so far, actually.
Oh, wow. Thanks. It
Yeah.
has been. I mean, Blessing and Peter have just graced us with so much knowledge and so much insight so far. So we want to thank them. Thank you, Blessing and Peter, so far, Obina. So, Refilwe, just tell me a little bit more about your work and how you got into it. Because you said psychology, it wasn't something you didn't wake up and say it wasn't something. It's something you were led to. So please tell us a bit more about that journey and how it has helped you so far.
Okay. My journey was quite long. It was quite a long journey, but I think with my own mental health related issues, I was drawn more into psychology because I wanted to be able to help others who've gone through the same thing. So being in that space, one, I still went through my own personal struggles, and two, I got to see and observe other people's struggles and how they cope. And just being in that space, I'll start with what I've seen. That is, I've realized how people would, for example, let's say, come for counseling sessions, just be there and have their sessions, and then after they're done, maybe a few months later, they're back again, and then you wonder why. Like you keep coming back to like, in a way that dependence on a professional counselor, and then you're like, okay, there's still some things that need to be taken into account. So realizing how like sometimes these are people who don't have that accountability or don't have support. So if you're not in a space where you have whether either community support or just accountability support, it's easy for you to fall back. And then also just realizing with my own mental health related struggles how I saw the power in someone reaching out, and funny enough, it was someone who's not really, really like, let's say, a blood relative. So someone who's like, yeah, come to my place. Let's spend time here and just I'll just be present with you. Someone sitting down with me. So being in that space where I realize how like there's power in actually someone reaching out and realizing you're not alone. and your struggles, it's okay to talk about your struggles, basically. So that's what led me to continue on with my work and just building spaces where people know that they can learn a lot in community and they can grow a lot in community.
Oh, nice. Thank you so much for that. And thank you so much for that insight. And thank you so much for sharing about a bit about your story and what you went through as well. So, and please, attendees, just remember that if you have any questions, please put it in the Q&A section and we will address them at the end of towards the end of the webinar. So thank you so far. We've got some questions and we'll look forward to answering them. We look forward to the presenters answering them. And I see Lucy Cecilia Lamin has connected with us. Good day, Lucy.
Yes, Philani, greetings and greetings all.
Greetings. Okay. So please tell us your country and a bit about yourself. And then Refilwe, I'll come to you. Don't worry. So please tell us a bit about the country you're from and just a little bit about the work that you do.
I am from Sierra Leone and the mental health advocate, of course, the lived experience from caregiver to becoming a lived experience. To becoming an advocate as well, because my advocacy is born from my lived experience.
Okay, thank you. Thank you so much, Lucy. So, I'll thank you. We'll come back to you just soon. So, Refilwe, please just tell me, you emphasize culturally grounded support. How can mindfulness and personal growth practices be adapted to resonate with African traditions and community values?
Okay, so that's a good question. First of all, I believe being able to understand the culture or the languages in a certain culture, instead of like, I think we easily tend to fall into introducing new activities or concepts. Let's say, for example, journaling or other mental health activities. But if you start with getting to a point where, okay, fine, what do communities in our different cultures tend to do? What are their values? What brings them together, maybe? And just what do they usually do as a way of like being more present? So incorporating that is always important. So after you understand that language, is being able to utilize those different activities, for example, whether it's music, whether it's traditional dances, whether it's different community uh, initiatives, like even just storytelling. How do you incorporate storytelling as a form of a mindful practice? How do I incorporate music and traditional dance and creativity like pottery or I know different cultures, some cultures are into like crafts and building stuff. How do I incorporate that as a mindful practice? And then getting into understanding how personal growth understanding personal growth from a community perspective, knowing that to get to that point as well, sometimes we have to be in community. So building certain community initiatives or programs, like maybe a lot of people in our culture tend to always meet up in like in these in our cultural spaces. I was gonna use my language, but you wouldn't really understand.
No, you can go ahead
Like,
and use it and then translate for us.
yeah, the cultural spaces, like maybe khotla meetings, that's what they call them, maybe like coming together and gathering to talk about different issues that are concerning the community.
Mhm.
So how do I use that space as a way of like creating a space where we can have conversations on mental health? I know you mentioned earlier how like sometimes we ask people how they're doing and it's like, I'm just good, I'm okay. But in that spaces, it's easier for people to talk about really what's going on. Oh, this has been happening at home. This has been happening around in my neighborhood. So we get to do such things in spaces that we're familiar with. So if we're just introducing foreign activities and telling people to do this, then there's no point in saying that we can break the stigma if we're not using what we already have to actually educate people on mental health and mental health practices. Yeah.
Oh, great. Because I find like in my mental health work, you cannot just go into a community without talking to the leaders of the community. And are the leaders receptive, or you have to really convince them? Or is there a way, like in your country, like how would you approach them in a way that is respectful when you want to have mental health awareness programs or well-being or mindfulness or the work that you do?
I know there's always you don't directly like go to the leader. So there's always like that second person first you go to and
Oh,
just bring your we still do just bring on your proposal or bring on your issue to them, and just you know like asking for whether you're asking for something or whether you need something to happen, but or just putting out your concern. I know our leaders around the nation, because we have leaders in different in our different like villages and cultural spaces. So I realize how these leaders are people who are always open to having the community speak up. I know that they've also built a space where like community can be able to freely talk, to freely work together. And I guess that's why we also have like the Kotla meetings, like I mentioned, because we're able to get together and just talk.
mm, wow. So I love the talking aspect. So breaking stigma is a recurring theme in your work. What strategies have proven most effective in shifting youth perspectives of mental health in Botswana?
Okay, so when it comes to that, is this firstly, okay, firstly we get into understanding the issues that maybe lead to stigma, right? So the
Mm,
issues could be maybe based on what I know, I feel alone. Or who do I really trust? Who do I really talk to? And other issues, which include tokenism, and getting to that point. Okay, fine, you see such issues, and now, okay, how do I get to a point where I address this? So you have to know the language of the youth again. So what I've observed is that young people are creative beings. So if we're
mm,
using creativity, we can be able to build a space where young people can gather, young people can be curious about what really do you want to talk to. So utilizing creativity and knowing where young people usually are. So you find youth in like online spaces, in schools, in different community spaces all around, and using such spaces as a way of like um getting to them, right? So if we're using creativity, we can use different things like whether it's film and storytelling, whether it's music, whether it's book clubs, and utilizing such, whether it's even art events, utilizing such to be able, like utilizing such activities to create or to have such conversations about mental health. So that's usually very much helpful, or um, a good way to bring youth together, and a good way to encourage um, youth to talk about such, and just building on accountability systems. So how do I build on such accountability systems? By having, bring youth in community and creating that space where they learn from other people's journeys, and they learn from other people's perspectives, and they get to understand that having an accountable partner or someone to help you keep you accountable allows you to be able to continuously take care of yourself. So if I know there's someone else doing what I'm doing, if I know that there's someone else, for example, I use an example of a book club. If I know there's someone else reading the same book as I, and we come together and talk about that book and how it's related to our mental well-being, I know very much that I'm in a space where I'm kept accountable.
Interesting. And do you have that dynamic where the older generation works with the younger generation?
It's a okay, so with that, I don't know if you're referring to just the idea of tokenism, but yes.
Yes, go ahead. Go right ahead. Like, do the young
Okay.
people work with the,
Oh, in a
I don't
good
know,
way.
yeah,
Yeah.
with the more mature people?
Yes. Okay. I know usually in different, let's say, counseling spaces around the nation, we tend to have a lot of older people engage with younger people. Even in clinical settings, a lot of, let's say, older people, let's say, are usually more in clinical spaces in the different villages and just are the ones who are providing, for example, counseling and just health related services. So we get to see that a lot, of which, yes, partly it's good, but also there are very much negative aspects to it because a lot of young people are in a lot of young people who are not in the city, for example, because you see this a lot in rural areas. A lot of young people get to experience this, uh, get to a point where they're like they don't want to seek counseling or counseling doesn't help because every time I go there, I get to see someone who is really much very, very older than me, who doesn't seem to understand me, who doesn't understand such related issues. So it's like a matter of like, I would prefer someone who's young. I would prefer someone who's young and qualified rather than someone who's older. That way I can be able to talk openly. I can be more comfortable in such spaces. So they are such, and it does create a barrier also.
Wow, that is interesting. And that is so true that sometimes younger people want to talk to younger people who they feel that they can actually identify with in the society. So thank you so much, Refilwe. So we'll just go on to our questions. We have a question from Eleni that I'm a big fan of peer support. The problem we have in Ethiopia is lack of evidence. Most people know peer support works, but we've had hard time to convince policymakers to include it as a formal treatment option. They ask for certification, which we don't have. We don't know where to get it. I'll be glad to hear if anyone has navigated this issue in their countries. Thanks. I would like to give that question to Peter, Obinna Peter, if that's okay.
Okay, thank you, Philina. That's a good question. I would say myself at the initial stage when I started this, when I started, let me say, peer support. I wouldn't say there is a established, should I say, position or workspace that is or that is titled peer support. So, in fact, I will tell you that when I was trying to express myself or see how I can be valuable or use my experience to bring value in my community, I also struggled with that challenge. So it was difficult because there's no position that is titled peer support. Here in Nigeria, I'm using Nigeria for example. But one thing I did is beyond looking for a certificate or to beyond looking for a qualification or sorry, a job that is titled peer support, what I did, I reached out to my communities. I offer that peer support without the title or the certificate of being a peer supporter. But I reach out using my experience to help those I see going through that challenges. So yeah, from
Oh, wow. I guess network
different
issues.
yeah, yeah.
Oh, you're back? Okay. So you basically, you went out, you took the initiative to go out in the communities with what you have and the knowledge that you have to help people. Okay, thank you so much. And also, Blessing, you also talked about peer support. So if you can also just give your 2 cents about the question that Eleni posed.
Hi, Eleni. Thank you for that question. So I think this is a struggle many of us have had. So for me personally, like Obinna said, in Ghana here too, there's no role like peer supporter. It's like people are doing the work, but it's not like recognized. So when it comes to certification, there are two approaches that many of us try to use in my country here. For example, we try to get that sort of professional backing. So me personally, I have my Bachelor of Arts in Psychology, but I recently applied for licensing with the Ghana Psychology Council as a paraprofessional counselor, and that has been approved. So that was a route I had to go because I wasn't seeing anything like a peer support certification. But also online, I've been doing some research. So I recently discovered that Lived Experience Australia, they have some online courses you can do where you get a certificate at the end of it. And I think Youth Move National, they also have something. I think that's a US organization. So I am still at the early stages of exploring that, and I'm starting a course on Lived Experience Australia. So if I find that there is a certificate at the end of it, I do not mind sharing that information and getting it back to the rest of you. But I think there's no and I think that that's a gap that does exist. That if we could do something about it, it would be really nice. Like, for example, we are here as people with lived experience. We are here as people who are working in this space of advocacy and human rights. Why don't we come up with a body to get ourselves certificated? Why don't we come together with educationists and then bring like multidisciplinary individuals together and say, okay, there is a gap. We don't have any like, let's say, regionally accepted certificates for peer support. So let's create something together that would be accredited and all of that, that peer support workers can now go that route of getting certified so that like our governments can take us seriously and then add us into policy and all of that. So yeah, I think that's a gap that's worth mentioning. But like I said before, lived experience Australia and then youth move national. So I'll still do some more research. Thank you.
Okay, thank you. No, that is so true. I think with as people with lived experience, we also need to have initiatives and not just wait for other people to do things for us, but also have initiatives, have NGOs, have organizations that also help people. And we are also people with lived experience. And then we have a question from Carly. She says, thanks all for this. A general question from me for all of you is that of interest. What kind of generational differences to do you experience in Africa when it comes to mental health? I expect there's some, as we have them everywhere, but I do feel that older generations are becoming more open, at least where I am based in UK. Has that shifted in Africa, or is it still strong and cause a division? So I'll start with Refilwe.
Um, well, I'll say it is something that needs to shift, meaning it hasn't really shifted, because we realize that a lot of people who speak up, it's a matter of like, okay, fine. The way I react to mental health struggles is different from the way maybe, for example, my mom or my grandmother reacts to it. So, there was a little there was a filmmaking session that I attended, and there it was a film on, I don't know if it was made somewhere in a country in Africa, I forgot where, but it was a mental health related film where like a mom and child were just having a conversation. The child was talking about her ideations, suicidal ideations, and the likes, and just how her and her friends have been going through it. And the mom was just, in a way, not understanding how you'd want to do that, because just explaining how she goes through her mental health experiences. So either by doing something else, distractions that are different, but those perspectives are still very much different. The way I see it is not the way someone older would see it. And it is a problem because, one, maybe for example, a lot of cases are related to generational traumatic experiences, and just how we've been through such mental health related struggles because of like certain family issues. But then if we not don't reach a point of like understanding that, oh, as an older person, yes, this is how I react to this, but I need to be able to understand um, a younger person's perspective. So it's still a common thing, but I realized just experiencing the whole film experience that I gave an example of was very helpful because there were older people present. So I feel like if more people adapt storytelling, it would be a great way to be able to actually see, because if we're having less talks and more like experiences where we get to really see what's going on, I feel like the older generation could be able to see the real truth, and the younger generation could be able to see like, okay, it doesn't mean that if this person, older person, is saying this to me, doesn't mean that they don't really care in a way, but it's just that they've experienced things differently. So it's something that needs to be implemented a lot, in our nation, I believe in Africa as a whole, because um, in that way we get to really view perspectives through storytelling. So yeah.
Okay, thank you so much, Refilwe. Thank you so much for that answer. And it's so true that that gap that is there, people need to be able to understand one another from the different perspectives. And I have a question from Obinna, from Carly, who says, what does the training you referred to look like?
Okay, the training I refer to trauma healing workshop is more like an avenue where people come together, people traumatized individuals come together, share their story. They pass through a series of lessons. It's more like we have a manual, a trauma healing manual, where they pass through a series of these lessons strategically placed to help them to become vulnerable enough to express themselves, share their story, and thereby healing begins. Their healing journey begins. Yeah.
Okay, thank you so much. Well, thank you so much, everyone, for sharing your stories, your vulnerable stories. Thank you so much, Refilwe. Thank you so much, Blessing. Thank you so much, Obinna. Thank you so much, Lucy. Before we go, I just want everyone to just have even 30 seconds. If there's a message that you want to tell people in Africa about mental health, or people in the world about mental health, just one thing that you can say. What we can do so that people do not suffer in silence. So we'll just have 30 seconds each, and I will start with Blessing, please.
Okay, first of all, thank you guys. Today was amazing. I think I'll just add on to what has been said so far, and that youth mental health is very important, and it differs because being a young person is very crazy. Like, you're going through a lot, and you're also navigating this poly crisis. So there needs to be a lot of emphasis, a lot of research, a lot of funding in this space. And I think that connects to what has been said already. Like, for example, Carly was asking about the state of mental health here. And we have the words. A lot of us know therapy speak. We can still have anxiety, have all of that. But realistically, we don't actually know what's happening. We don't have mental health literacy. We don't have mental health support. So my emphasis is that there should be more support for youth mental health in Africa. Thank you very much.
Okay, thank you so much. And Refilwe, 20 seconds. Please tell us. 20 seconds.
I'll say firstly, have less conferences and build more safe spaces, and also just be in a place where you get to work with other people, because in that aspect where you get to learn and grow with other people, you are able to build better systems for mental health. So be encouraged that other people also are going through the same thing or similar things.
Thank you so much, Refilwe. Thank you so much. And then Obinna, 10 seconds.
I would say creating a mental health resilience community is not just an individual act, it's a collective act where everybody have a part to play. The community, the individual, the family, the professionals, we all have to come together. Everyone who is listening to this webinar, I believe you have heard something. It's more like pass out the message. You're a little bit trauma aware. So keep passing out the message where we have a trauma aware community. Thank you.
Thank you so much. Thank you so much, everyone, for this webinar. Thank you so much, everyone who participated, for people who asked questions, people who attended this webinar. Thank you so much for being with us. And I'll just say thank you, everyone, and have a good day. So, as I said, in Africa, we should not suffer in silence. And we thank you and we say good night. Thank you.